Good day, viewers and listeners, and welcome to the COVID-19 update for today, Friday, November 26, 2021. I am Godfrey Brooms. Today, we will be speaking with the Minister of Health, Dr. Frank Anthony, on the national decrease in the COVID-19 cases, but the progressively increasing cases in Region 6. He will also update us on the new variant and what scientists have discovered thus far.
So right now we have 1,572 active cases, and this reflects maybe an overall national decline in terms of our cases. But while we have this national decline, we are also seeing that in some regions there have been an increase. Uh, this decline I would attribute it primarily to a decline in numbers in Region 4 and in Region 3. And in particular in Region 4, Region 4 now has the highest vaccination rates in the country. So perhaps that is contributing to a reduction in the cases that we're seeing. But while we have this overall decline in the country, in Region 6, for example, we're seeing a worrying trend where there are increases in cases in Region 6. August, we had 174 cases in August. Then by September, that went up to 222 cases. In October, that increased to 363 cases. And then in November, we are now at 512 cases. So right now we have 63 persons who are in hospital, with 38 of them at the Ocean View Hospital. Of those 38, we have 15 persons in the ICU. So we still have very severely ill patients, and this is something that I think people, as numbers come down, I think people are getting too complacent, but we are still getting persons who would have the severe form of COVID and come to the hospital. Of the 38 persons that we currently have at the Ocean View Hospital, 23 of them are pregnant women. So again, I want to appeal to pregnant women, if they haven't been vaccinated, please go and get vaccinated, because this would, at least if you get COVID, you will have a milder form of it. So the vaccine is protective. Right now, of the 63 people that we have in hospital, 23 of them are pregnant women. So I hope that people are understanding that this is a serious thing, and pregnant women really need to get vaccinated. So a lot of the prominent societies have put out guidance to obstetricians, informing them that these vaccines does not harm the mother nor the child, and they have done studies and they have released those results to show that there's no harm that would come to the child. So the vaccines right now are recommended. You can get them in any one of the trimesters, whether it's the first, second, or third. It's never too late to get the vaccine. And even after you would have delivered the baby, that you can also, if you weren't vaccinated during that period, you should still take your vaccine while you're breastfeeding, because it would also add an additional benefit to the child, where the antibodies that you have developed with the vaccine can pass through the breast milk to the child. And some of the scientists are thinking that it probably would be more infectious. So again, these are three key parameters that they're monitoring to see whether or not it's more transmissible, whether it's more infectious, and whether it evades the immune system. None of these answers are available as yet because of the recency of the discovery, and therefore it would take a little while for us to understand more about this particular variant. We have 398,949 persons who would have received their first dose vaccination. That's 77.8% of our adult population. And for second dose, it's 275,126 persons. That's now 53.6% of our adult population. For children between 17 and 12, we've had 28,985 first dose. That's 39.7% of that age cohort. And we've had 20,153, or 27.6% of the age cohort receiving their second dose.
And this has been the COVID-19 update. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. Remember to wear your masks, stay away from crowds, and take your vaccine. Watery Brooms saying goodbye for now.